don't know how to follow that, but it's all, hand hygiene is all part of how we keep our patients safe. As Paula was saying, we want to prevent those infections and keep people safe from harm while they're in the hospital. So that's what our quality improvement strategy this year is all about. And I just wanted to highlight a couple of things that I think everyone needs to know about. Because quite often at the hospital, we're all so busy and we feel overwhelmed, we're stretched, and we're working on so many different things. And all of those things are important. But what we've come to realize is that to really make big improvement in some of the areas that are important to us, we need to focus a little bit more. So what the senior team has done this year in developing our quality improvement plan for the year is that we've said, you know, we're going to identify just 4 priority areas that we want everyone in the hospital to be focused on to make improvement over the next year. Not that those are the only things that are important, but we think if we all share in these 4 priorities that we can make a bigger dent and really get somewhere with them. So we've identified 4 areas that we're going to focus on, and we're calling them the big 4. And there's 1 for each of our themes. So you know already that our themes are access to care, service excellence, team engagement, and fiscal responsibility. Oh, sorry. So David, help me. So where are they actually listed?
We just have the 2 slides.
Pardon me?
We just have the 2 slides.
Oh, okay.
Oops.
I thought that the names of the priorities were on here. Anyway, I'm going to have to add them. So the 4 priorities are, under the category of access, we're focusing on the waiting time for patients that are admitted to a bed when they come through the emergency department. And they often have to wait a long time to get into an inpatient bed. So just to give you an idea, our target at the Ajax site, I believe, is about 48 hours, I think, is our target that we're trying to get to. Because right now we're at about 70 hours, which if you think about it, that's about 3 days. Does anyone know what the provincial target is? Because this is something that all hospitals are trying to get better at. So the Ministry of Health has set a target for the whole province. Anyone have any idea? 8. Why are you laughing? Oh, okay. So, you know, so the province thinks that we need to get down to 8, but for us, a big improvement would be just to get down to 50. I mean, if we can do better, that would be fantastic. I know Arden and others would be really happy. So we're all going to focus our attention on that, right? And it's not just about the emergency department. It relates to how quickly we get patients discharged and home at the other end as well. Under service excellence, the priority that we're focusing on there is the mortality rate. The official term is HSMR, Hospital Standardized Mortality Ratio. It's something that every hospital in the country tracks so that we can compare ourselves to others. And a mortality rate of 100 is sort of the norm, the average. That's what's expected. So we want to be lower than that. So right now we are lower. We're doing quite well. We've come down a lot in the last few years. So we're currently at about 92, and we'd like to get our mortality ratio down even further to about 90 this year. So that means we want to focus on deaths that can be prevented and keep patients safer. Under team engagement, our priority there is staff satisfaction, which relates to all of us in the room. You want to come to work and enjoy what you're doing and feel like you're in a safe, pleasant environment. So that's important to us. And we know that there's also a relationship between staff satisfaction and patient satisfaction, or customer satisfaction, if you work in an area that doesn't serve patients directly. So happy staff mean happy patients, and everybody's just better off as a result. So there's a survey that we use called the Work-Life Pulse Survey. And that's what we're going to be using to track how we're doing on staff satisfaction. So there's a question on that survey that asks you how satisfied you are with the organization. Not with your job, but with the organization. And that's the question that we're going to be tracking. Okay? And when we last did that survey in December, 48% of people that filled out the survey gave a positive response. We want to get that up to 50%. We want half of the people to be giving us a positive response on that. And under the category of fiscal responsibility, which is so important because without money, we can't pay all of the great staff that work here to take care of patients, and we can't buy equipment and all of the other things that we need to keep people safe. So the fiscal responsibility piece is just as important, and our target there is to basically have a balanced budget and to achieve the total margin that we've budgeted for. So those are the 4 things that we want everyone to be paying really, really close attention to. And we wanted to point out that when you're looking in your departments for ways to make improvements in these things and to get even better than you already are, don't forget about lean. That's our management philosophy hospital-wide. And there are lean tools that we've all been taught through lean training that can be used to help us with all 4 of those priorities. So we want people to be using lean to make those improvements. Okay, any questions? So one other thing before I go. Not sure if it's going to rank up there with the Huff Film Festival, but Passport to Safety is back again this year. This is the 3rd year that we're having it. Notice that we've changed the name slightly. We used to call it Passport to Patient Safety, but this year we're also having a big focus on staff safety because that's also critically important. So it's Passport to Safety. We're going to be doing it for 2 days at the Ajax site and 2 days at the Centenary site in June, and we want as many people as possible to come. We know that a lot of that depends on managers being able to free people up to come, so we're making an appeal to managers who have notice, so try to see if we can arrange schedules to get at least some of your people down. If you can't come in person, there's still the opportunity to do it online, which is fine as well, but it's also good to come down with your colleagues and get that interaction by actually being there. So keep those dates in mind. This is really important. It helps us to meet some of our accreditation standards as well, which talk about creating a culture of patient safety, educating all of our staff about safety. And we have accreditation coming up in less than a year and a half, so we really need to start thinking about meeting all those standards. Questions? All right. Hope to see you all at Passport to Safety then.
Yes. I just want to give you the heads